This is what Plan A looks like. Personal choice, personal responsibility. Decisions like masks left to the individual. But with each day and each week, this is playing its part in driving up COVID infections, hospitalizations, and ultimately deaths.
I'm expecting an incredibly challenging winter if we don't start taking some action now.
Professor Summers treats the sickest patients. She says now is the time for the government to make interventions like mandatory social distancing.
I'm an intensive care specialist. I deal with emergencies all the time. That's my job. I'm pretty certain that there is no emergency for which waiting for it to get worse before you take any action is the best way to handle it.
Cases of COVID are up in all but one region of England, and rates are comparable to March when the country was in full lockdown. Despite these warnings, the government says it's not going to push the button on Plan B. There will be no compulsory wearing of face masks or asking us to work from home. In fact, Boris Johnson says his government scientists told him this is exactly where we would be. No handshakes for the Prime Minister on this school visit in Northern Ireland. It's children who are seeing the highest numbers of cases, and that's why there is a big push to target this age group for vaccination.
We're in a much better position going into the autumn, the winter now than we were 12 months ago. Incomparably better because of the huge level of protection that we got from the vaccines. 90% of the adult population has antibodies right now. But we must fortify ourselves further.
So, no Plan B for the moment. Instead, it's Plan A, but better. Vaccinations and boosters.
Have it done, otherwise you're putting other people in danger.
It's only a little pinprick after all, and it could save your life.
The government is confident the NHS will cope, but the health service's own medics warn it might not. But there is agreement on one thing. The hardest of winters is on its way. Ashish, Joshi, Sky News.